Hi, everyone. Thank you for joining us today. Welcome to today's event for Black History Month. I'm Christina, and this is my assistant.
Hi, my name is Sydney.
We are peer health educators at Student Health Services, and we'll be talking about healthcare disparities today.
All right. So before we get started, we just want to do a bit of housekeeping for this Zoom. So this is a panelist-focused space, so we ask that you stay on mute while the panelists are speaking. We ask that you please be respectful of our panelists, and there will also be a segment at the end for an open Q&A. So please have those questions ready and feel free to type in chat when that time comes. So before we begin, we just want to give a little background on Black History Month and how it is relating to healthcare for our purposes today. So the theme for this year's Black History Month is actually Black health and wellness, and is all about recognizing Black professionals in the health industry, as well as alternative health practitioners such as doulas, midwives, and naturopaths, and etc. So what are healthcare disparities? So they're defined as differences in access to medical facilities and services, and also differences in rates of disease occurrence and disabilities. And affected groups are defined by characteristics such as race, ethnicity, age, gender, and socioeconomic status. So let's talk about specific disparities that are experienced by the Black community. So first, there can be a lack of access to care and providers, and this can be due to socioeconomic differences or geographical differences. There are higher rates of disease, morbidity, and mortality. This can be seen in maternal and infant mortality, heart disease, diabetes, and cancer. And there's also a lack of health insurance, and this is especially in areas that have high population of African Americans, so Texas, Georgia, a lot of the southern states. So let's move on to our discussion. We want to say that everyone deserves equal opportunities for access to healthcare, including the Black community. So we have some amazing panelists today that will discuss healthcare disparities in practice and research. And we are going to start by introing them right away. So I'm going to stop sharing right now. And we will start with Ismael. If you could introduce yourself.
Sure. Thank you, everybody. And it's such an honor and privilege to be part of this panel. My name is Ismael Salamanca. I use he, him pronouns, and I'm the Director of Health Services at the LGBTQ Center here in Long Beach. I've been doing this since 2000, so going on 22 years of working around HIV prevention, education, outreach, testing, and treatment here in the center. And I'm just very honored to be part of this group, starting my education career as a nurse, registered nurse, moving towards becoming a nurse practitioner, then eventually getting my heart pulled towards program design and development for the LGBTQ community of everybody here in Long Beach. Thanks.
Thank you so much. All right, next up we have Rosemary.
Hi, my name is Rosemary Tilmon-Kellum. I am a practicing physician assistant here at the Student Health Center. I've been practicing now for about 28 years. I've worked a lot with the adolescent young adult population throughout my career in different kind of aspects. And we have a whole host of things that we want to go over, and I hope you guys enjoy our presentation.
Thank you. And then we have Dr. Johnson.
Good morning or afternoon, everyone. My name is Dr. Amber Johnson. I'm an assistant professor in the Department of Health Science. I'm a community health education promotion expertise, or I have those expertise. I'm also a researcher that researches racism, discrimination, and cardiovascular disease risk among Black women. I currently lead the Black Health Equity Collaborative for the city of Long Beach. That collaborative is a collaboration of 16 Black serving organizations and 3 Black serving mental health providers that are looking to create programming, advocacy, and other efforts to reduce Black health inequities within the Black community in Long Beach and beyond. So I'm so glad to be here, and I think this is a very important conversation.
Thank you so much for those intros. We're so excited to have you all here. And we will get started with the discussion right away. So we have some questions for you, and we will start with Christina asking those questions.
So the first question we have is, can you give your own definitions of what health disparities look like, especially for the Black community? And then I also typed it in the chat for reference.
Well, I mean, I can take that. So it's very difficult to see on the surface level what Black health disparities looks like. A lot of times from my lens, we look at that from a data perspective. When we're seeing and just defining health disparities is when there is a significant difference between one population group versus another as it relates to health outcomes. And what we see in Black communities is that there are differential rates of cardiovascular disease risk, infant mortality, and maternal mortality, in addition to asthma rates that are, in addition to another, HIV and so forth, and other chronic diseases that are very prevalent in Black community. Now, the thing that separates that from the inequities is the precipitating causes of those disparities. And those are the inequities that we're seeing, from the food deserts to access to healthcare to whether there is culturally affirming care that is provided for members of the Black community. I think what we can see tangibly is the health inequities, but it's very difficult to see on the surface that there is a differential, even mortality rates between Black residents, particularly in Long Beach and the greater United States. So yeah, if anybody else would like to chime in on that, I just wanted to add that, the disparities are very difficult to see, but we can see very clearly the inequities.
And yeah, and I can elaborate a little bit more from a medical provider perspective, because when I look at health inequities and the disparities that are associated with the Black community, I try to define which community that I'm in. Now, specifically, we're here at Cal State University Long Beach. Thank you all for joining us. But it actually starts outside of the campus. And so when you look at what's considered a community, it has a lot to do with what disparities were you confronted with before you got here. And so as Long Beach State has a low Black student enrollment, it's a lot to do with lack of preparation for admission to university. So why is that the case? Because a lower education will translate into less income. It affects your living conditions and actually your health outcomes. And because we have a large number of people that have a lot of health disparities with, like Dr. Johnson said, with heart diseases, and that includes your strokes, your high blood pressure, heart attacks, and cancers, and your asthma, and emphysema and diabetes, and not to mention we're Black Americans have a higher rate of turning positive for HIV. So with all of the sociological attempts to improve health outcomes through several type of pathways, the question would be, well, why are we still a leading forefront for cardiovascular disease, stroke, and all of that? So I feel it has a lot to do with education, educational opportunities. So when you don't go to school, you have a suboptimal income, so you can't get a very good job, or if you're unemployed, you're living in poverty, you have access to healthcare. No insurance is really difficult to get healthcare. If you were to get healthcare at some point, you need follow-up care, and then there's no access to the follow-up care. And working for years in urgent care, you see people at the extreme case. They come in after they've had something that's out of control, and now you have to manage it. However, they may not come back. So when you're trying to deliver valuable health care to our Black community, whether it's here on campus or off campus, there's a lot of different barriers that we run into. So that is why our numbers are worse. And there's a lot of room for improvement.
If we have time, I would love to jump in because Dr. Johnson brought up a really good point about competency. I think in my department where I work in the health services at the LGBTQ Center, it's very important to have competent staff providing the care. And competency could be education, like we were just talking about, but also cultural knowledge. So hiring people from the communities that you need to serve is crucial to what we're doing. We talked about HIV in the Black community. I'm seeing a lot of the work that we're doing with the Long Beach Health Department around pregnant women and syphilis who are not properly being diagnosed or tested or even treated. So we're seeing like 300-400% increase in syphilis cases in unborn children or infants. So that's one of these things where you have providers who don't live in the area, who don't know the culture to be able to diagnose and culturally appropriately bring up the conversation. We were talking a little bit about disparities and access and barriers. When we talked, Dr. Johnson, you brought up health deserts. There's also, food deserts. There's also provider deserts in Long Beach alone, where the predominant people of color, Black communities live in certain portions of Long Beach where there aren't, focusing specifically on what I do, LGBTQ focused competent care in those areas. And now we're asking people to travel to a place where they may not feel comfortable or even feel welcome. I mean, we can talk about redlining in Long Beach, where there are particular areas in Long Beach that historically have not been welcoming to people of color, Black communities. So when we start thinking about disparities, it's beyond what most of us think about around health. There's so much history that's there where we need to really step up and hire those folks that know their culture, their communities, their needs. And if they are not educated, like we were talking about, build that education where it's on the job, or even just opportunities for folks to learn those skills that they'll need to be competent. Because I'm going to be the first one to call things out, where I'm not a Black person. I'm doing this work and I'm trying to train these folks, but there aren't opportunities for folks to learn and jump into that community. So it becomes people like me to create those opportunities where I work to make sure that we hire folks, train folks, and develop them. And it's sad to say they don't stay here, because they learn, they get the skills that they need, and they go open their own nonprofit, which is great. But we need to create those opportunities for folks to be that face of those programs to help the disparities that we're noticing.
Thank you so much for those awesome answers. Oh, this panel is going to be wonderful. So for the next question we have, so in your personal experiences, either in your current place of work or past jobs, have you seen examples of workplace combating racial bias and discrimination? And do you have any recommendations for other places of work as well?
I went first last time, so it's on you guys.
I'm being respectful because you all are amazing. So I want to bow down to that.
I'll go. So like I had mentioned earlier, our Black community, which includes our student, staff, and faculty here at Long Beach State, is very low. Being an undergrad here in the mid-'80s, we had a very high Black population here. So it's kind of disappointing to see the numbers now. And like I was mentioning earlier, if you don't educate our Black students, then you don't produce culturally competent providers. So you do see that there's a problem with our Black students matriculating, as well as building healthcare communities in the city of Long Beach. And it's not just the city of Long Beach. We will talk about Long Beach, but it's not just the city of Long Beach. So when you come here as a Black student, you don't see staff or faculty in teaching and professional roles. That's a huge problem. That's a reflection that there's an issue with our hiring process here. And I have to applaud through the movement in the last couple of years that it has surfaced, and our leaders are trying to implement some changes. And we would like to see those changes tomorrow. but realistically, it's a planning process. It's implementing. It's rolling out. It's getting support from the campus and different kind of community help. So it sounds really easy, but it is the issue with not producing enough of the Black individuals to serve our Black population to combat health disparities within our population. And so.
Yeah, I thank you for taking on the university side, because I was trying to figure out which one to speak from. So I'll speak from Black community side. So just recently, as we saw very prevalent in the COVID-19 pandemic, is the disproportional mortality rate of COVID-19 among Black Americans. So Black Americans and in Long Beach, it followed the same trend. And so as we were thinking about how do we reach Black community, we had the opportunity to develop a collaboration with the City of Long Beach Health Department. But the issue is that when we think about community and how we reach community, we need to partner with the people that are in the field or in the community doing the work on the everyday level. So when asking, okay, well, who do we partner with? And then, there was a notion of there was no Black serving organizations. And I said, that's impossible. I can name 10 Black serving organizations off the top of my head. How do you not know of any Black serving organizations? And so that's how our work with the Black Health Equity Collaborative started. And we realized that what if we trained the people that were already on the field doing the work, recognizing the work that they're doing, funding them, which is very important, and recognizing them and their importance in combating COVID-19 in the Black community in Long Beach. What would happen if we actually did that? And so we work with people from the community, this Black serving organizations that really just took hold of what we were, the vision that we saw, and we funded them. We created RFPs to have them do the work that sometimes they do without even being compensated for. And so I think that's one way to combat, but it was a systemic issue because there were organizations that had long-term relationships with the health department. And in some processes, they could, facilitate funding to those organizations fairly quickly. So when I asked, well, can we facilitate that process? They were like, well, there's no Black serving organizations that we have those processes established with. And I said, wait a minute, this is systematic racism. And not that it was quote unquote intentional, right? But that's how systematic racism works. You can't see it unless you look at the policies, unless you look at the guidelines, unless you look at who you're involved with and who they are targeting in their outreach. If you're not working with Black serving organizations, then 9 times out of 10, number one, you're not recognizing the hard work that they're doing. And number two, you're probably not reaching the Black community. So when we think about combating, workplace, I can't say workplace bias or discrimination because I don't work at the city. But what I can say is that through our efforts and through our advocacy, we combated the systematic racism that disenfranchised Black residents in Long Beach.
I mean, perfectly said, Dr. Johnson. It's how do we separate between systematic and where we got comfortable? Like, I feel like a lot of the organizations that I work with have gotten comfortable with like, oh, well, we don't have any Black medical staff or any Black testers. They don't apply. And I can't really talk about stuff that we've done or that's happened to the organization as a whole, but what did come out of the George Floyd movement that happened a few years ago that really did open up a lot of leadership's eyes to realize where their racist biases were coming from. We realized that we can't wait for people to apply for a job. We have to go find them. We have to go build relationships, attend meetings, to be able to connect with these folks or invite people that we know into these meetings to see if that's something that they're interested in. And personally speaking, we did have in those 2 years internal issues when it came to racist bias. and having to have that courage and ability to step up and say, the executive director, the board chair, you need to be more inclusive. You need to do more active recruitment of board members, because one of the things I wrote down when you two were talking is you need leadership at different levels, but you also need front facing or community facing leaders. We do have people of color in leadership, but they're not visible to our community. And we've all used the word community so far. We're a community center. You have to really show who your leaders are, not just your director of development or your CFO who no one sees. You need the folks that are in front of the name of the center, let's say, to kind of show that. So I feel like one of the things that we can do is just step up and use that voice, because sometimes the folks that you're expecting to speak up may not have the energy or the strength or the ability to do that, and the rest of us need to step up and call out when we see something that isn't working correctly or needs to be changed.
Thank
And
you
I
so
want to
much. Yes.
I want to further comment. Thank you, Ish and Dr. Johnson. I think at every different level, organizations, you're going to find internal biases and microaggressions. And what I personally, and I do say personally, I found is the lack of acceptance of our culture and who we are and our mannerism. It's always mislabeled. And that actually, it interferes with our ability to have intellectual achievement or career advancements or professional development. And that in itself also kind of hinders people from getting that higher education to be able to deliver services out in the community that are affected. So, and like I said, I don't feel like it's just here. I think it's a common problem in many locations. So I always say awareness. There has to be a means of awareness, whether it's internal to your organization or even external with policies and anything to bring to the surface that this does exist, it's real, and it needs to be addressed. So, but thank you.
Thank you all for those awesome answers. Moving on. So what are some ways that someone can advocate for themselves, or what does self-advocacy look like in healthcare?
I would love to take this one on, because it really just starts off this conversation that I had at the National HIV/AIDS Conference in DC a while ago, where panelists were amazing. We have celebrities. I think Nancy Pelosi even spoke. And the stage got taken over by a group of transgender people of color, predominantly a Black trans woman, who interrupted everything and said, this needs to stop, because it's not my job to advocate for my health. It's your job to know what I need. And she was bringing this up to where a lot of the providers that were on the panel were saying, it's very helpful if a transgender person tells me what they're feeling, what they're experiencing, what symptoms they are going through, when this person is already advocating for everything else, their life, their access to a job or education. I don't think self-advocacy when it comes to health is something that has to be on the patient. I think it's a weird thing to say. It's disproportionately unfair. There are other people who you have, I don't know, red skin or a red rash, or you look like you have a fever. There's a lot of that stuff that happens with other people who are not Black. And I think when it comes to people who are Black, they're expecting the patient to say, well, this is what I'm feeling, this is what I'm going through, not really taking into account that they've had dozens, if not hundreds, of other providers who misdiagnosed them, who didn't listen to them, who didn't believe their symptoms. So I love the idea for most of us to be advocates for ourselves, but it's such a hard thing to ask our patients to do, specifically the patients of color, transgender clients, Black patients, to say, hey, I need you to speak up a little bit more so I can know how to take care of you. I understand the benefits of it, but it just doesn't seem fair when I start seeing the patients who need the care and are just tired and just hurt from having to do this again, which kind of ties into what we were talking about earlier about disparities. It keeps you from wanting to follow up to your doctor. It keeps you from wanting to kind of do this legwork to take care of yourself, where now you have to like start from scratch and explain everything that you're feeling and doing. And I love the question, but it's just, I feel like sometimes it's loaded specifically when it comes to LGBTQ folks, people of color, Black patients, where it's just, yes, we should advocate for ourselves, but we're tired, I think.
That's true. So I've been in support of the Black community, but now I have to support my healthcare providers. You know, healthcare has, or healthcare providers have so many demands on them. And unless you wear our shoes, it's hard to see that you can't do much in 10 minutes. So a lot of schedules are compacted on a daily basis. And so to be that practitioner that wants to do the full gamut of the assessment of your physical and mental well-being, you have to be real patient, and you have to be willing to, you know, run overtime, run out of time, work long hours, what have you. But that's the reality of working in healthcare management organizations. You have panels, the panels are loaded, you have to see so many people and so many patients in a day. And you do expect the patient to come in and say, this is what I need, this is what's going on with me, da, da, da. So I think it goes a lot with the individual provider. You know, personally, I am a thorough and diagnostic clinician. I will spend, I don't care if it takes 30 minutes. And I actually will ask those hard questions, from being a physical problem to a mental problem. It's a lifestyle problem. Is it something, home life, that's affecting the reason why you're here? But you, to a certain extent, we do need the patients to be an advocate for their health. If for some reason that they have ran into roadblocks, then I think that should be considered as well. And I have always resources where I can recommend where they can even work around those. But know that even with this pandemic made it worse, that our healthcare providers are stretched thin, and on a daily basis, they're fighting burnout. And so self-advocacy is kind of hard to kind of overlook as not being the patient's problem, but healthcare providers are really, they're doing their best in a lot of situations. I understand what you said, Ish. I'm not dispelling anything that you said, but wearing my shoes here at the university, sometimes it's real difficult to get disclosure from students. And there could be a lot of reasons why that is the case. But I think on the most part, you know, the majority of us really do try to get down to what is the essence of the problem. And specifically here, we have such a great behavioral health, mental health support throughout our campus, you know, to help with any of the basic needs, any kind of living condition situations, classroom situations. But what we offer here is not realistic outside of our school here. So when you talk about the self-advocacy, you have to look at, well, where is this person coming to me at? So I think, you know, that's something. I still love you guys. You guys get great comments, but I'm a healthcare provider.
Just to jump in, I wanted to play my side. I know you were going to step up. My nurse practitioner is swamped, but I get it. There's two sides of every coin. We just didn't find the solution. But thank you for all you do. You sound amazing, and I need to meet you in person and see what you do at your site.
If I may add, I think, you know, I run into this question of, my research is focused on racism, particularly the emotion of shame and how shame has physiological effects that could lead to cardiovascular risk, particularly for Black women. But oftentimes when I'm talking about my research, particularly because I'm talking about these interpersonal experiences of racism, I get the question, well, you know, how is that going to change the system of racism? And my response to that is, well, what do we do in the meantime until we move the needle, if the needle ever moves? And that is, we particularly as Black women, need healing in this process. A lot of women that are doing the work of even in advocacy work, there's a need for a healing space and understanding how that healing happens. So I understand, and I think in this question, the need for self-advocacy and the need for culturally affirming care, whether it's my trans sister at the conference or whether it is, anybody, particularly I'm thinking, reflecting on Black women receiving, pregnant Black women, that oftentimes their pain providers don't believe what they're feeling, right? And so I think if I were to find a happy medium is, believe your body. If we were talking about self-advocacy, right? Believe you know if something's going on with your body. And we need to trust ourselves. And sometimes we do have providers. I'm fortunate to have, friends that are doctors and PAs, and they tell me about those struggles of having to see, having 10 minutes for a patient, then 3 minutes to take notes. And I'm very conscious of that, particularly when I'm going into healthcare. So we have to believe, and I think to a certain extent, until we are able to have more culturally affirming providers, that we will unfortunately have to advocate for ourselves. And I think what that looks like is believing yourself, vocalizing your experiences so that you can have a better experience, hopefully, and I put that in quotation marks, with your healthcare provider. But on the flip side, we need to also do the work of creating or nurturing providers that are culturally affirming. I think that when it is so important to disclosure. It's so important to that established relationship, and it doesn't necessarily have to be another Black woman or of someone in the same racial ethnic identity. But I think about my grandmother, who is 92, my mother, who is in 71, and myself, and how through 3 generations, we've had the same experiences that reflect on us in different ways. So I think, advocacy is trusting yourself, knowing that sometimes you're just not crazy. And if you are feeling like you're crazy, maybe you can, discuss that as well. But I think that it is so very important that we continue to push the needle for training, education, recognizing, building our kids up in 5th or 6th grade to discuss the possibilities of healthcare. I think Rosemary had a very good point. We need to create a pipeline, not just starting in high school, but middle school, that's going to create a pipeline for healthcare providers. But I think it is so important, even when I go to my healthcare provider, I sometimes suffer from white coat syndrome, where like my blood pressure is going up, and I'm like, I don't know, I have to present myself in a certain way. But that immediately changed for me when I had a provider that I would present a certain way. I made sure everything was put together, and then she asked me just one simple question: "Girl, how is it really?" It was that one question that made me put down my guard, because I felt like I could let go of this persona of a Dr. Johnson, and I can really talk to her and say, you know what, I have so much anxiety. I don't feel like this. This is getting to the way that I eat, like I'm stress eating and my weight is going up. And so it's the simple things that create a trust between the provider. So again, I don't want to overstep my time, but we have to do both. We have to advocate and vocalize, and we need to have more discussions about that, particularly in the Black community. How do we advocate? Also, but we need to still continue about the systemic things that create culturally competent and culturally affirming care.
Wow, that was amazing. I think you provided great insight on self-advocacy from both patient and provider view. Thank you for sharing your personal experiences, because I know that there are a lot of health professionals and aspiring health professionals in this Zoom right now. So the question is, what's some advice for people of color going into the healthcare or research profession?
I'm just going to start off because I really, again, can't stop saying how awesome it feels to be sitting next to these individuals. I think is having that role model to look up to. So like the Dr. Johnsons and Rosemary, because if I was someone that wanted to go into research or into the health field and saw people who looked like me and cared about my community, I would want to do it more. I never really completed my education because there was no one either in my direct family or someone that looked like me, whether it's a queer, cis, Latino man that was doing what I was doing. But I think if you want to pursue something, it's really helpful to have those leaders out there that are already doing the work and blazing the trail and doing it with a way that it's not just a title and a job and a paycheck, but there's a passion. And I'm hoping that I can be that for my Latino people that are coming behind me. But I feel like Dr. Johnson and Rosemary are those examples of people that are doing what they're doing, and they're doing it with conviction and with heart. So I think that would be my 2 cents.
And I agree with you, Ish. I know working at, like I mentioned, I worked for a large popular health management organization. And I just recall how when I got patients of color, when they came to see Rosemary, they'd be like, Rosemary. But it was just a reaction to see a Black provider, Black patients seeing a Black provider. And so it is important for us to be visible out in the community or in healthcare, so that people can, or the younger youth can aspire to be like persons like myself. And I have always tutored young kids. I think since I started when I was 18, and math was my passion. And I wanted every kid to love math like I did. Kids don't like math very much. But I know that that's one of the hurdles with trying to go into healthcare or science professions, is that they think, oh, math is really hard. So I always targeted a group of kids, and I tried to dispel the hate or the fear of math classes. So it's a huge problem with our population where they don't choose certain kind of courses that will support healthcare professions. And there's a lot of effort to increase the interest at certain at certain levels here. My kids actually went through the Long Beach Unified School District, and I know when they went through the primary and secondary education, we had some of the best programs that prepared students to go into particular careers. And at every high school in Long Beach, there was a healthcare program. And a lot of the middle schools actually had different kind of programs that would feed into the high school programs that would prepare the kids. But even looking back, there just wasn't that many Black kids that were in those programs. And so to improve this is, it's multifaceted. There's just not one thing to do to encourage our kids to want to take on the courses that will prepare them properly for healthcare professions. So the one thing this generation has for them, though, is social media. And there is not one social media platform that doesn't discuss how you can get help in whatever you're struggling in. There's shadowing that's available, there's mentoring everywhere. And so what we need to do is spark the interest at a very young age of wanting to be like me or other Black healthcare providers. And, there's all kind of health fairs, there's all kind of things that go on within the community that could expose us as professionals. And, just being out there and being seen is like to me is like the fastest and easiest way to expose that there are people like me and you can be like me. And then after that, start seeking, what do I need to do to go into this career? And, now with the pandemic and all the behavioral issues, I always say clinical psychology is the way to go. And to me, that's a part of science and psychology. And so that field is huge. So, that's one of my goals, is just to educate people as often as I can as to the different kind of professions that would allow you to deliver some culturally sensitive care to our people. So the opportunity is there, and it starts with people like me that's being out in the community and visible, in which I do a lot of community service, a lot of volunteering.
I have a lot of advice. I want to see if I can make it very straightforward. I think when I hear about math and professions, I'm going to be honest. I didn't get into math or sciences until I got to college. I barely got into college. And that's simply because I came from a low income single mother household that we had to work. As soon as I was able to work, I worked. And my primary responsibility was contributing to the household so that we could survive. And so thinking about college and thinking about school just was the last thing on my mind. So I went thinking about healthcare or research, but I just by chance happened to, go to take the SAT and apply for college, one college, and I happened to get in. And I realized when I got there that I'm really good and I'm really interested in these things. But there were some, deficits because I had not pursued math or, research or any of that. But the thing that I did was ask for help. Sometimes it's so difficult to ask for help because you don't want that shame of not knowing. And that was me. I didn't want people to know that I couldn't write. I didn't want people to know that I wasn't getting it. But once I let go of that shame, a lot of doors opened for me. Instead of working at the fast food restaurant, I started working with a professor, made the same amount of money, but made decisions that put me in a better position to do what I further my career goals. I think that if I would have some or offer some advice is to ask for help. Don't look at the left or people left or right of you and where they are. Plot out a path for you and go along your path on your own pace as much as possible. And second, sometimes I think people of color and I'll speak from my experience as a Black woman, we tend to put all this pressure on us because we're usually the only one. Like in my family, I'm the only one that has a PhD. I'm the only one that is a different social economic status. But this is our lives, right? If this being in healthcare, being in research is something that you have to do for you. And so you can't put that pressure. You can't have the whole Black community riding on your back. You have to do this for you. This has to be your passion. As you saw that Rosemary talked about what that life is for her. And that's something I can hear the passion. So these are decisions that you should be making, not because you're the only, but because this is something that you have a strong desire to do. So I would advocate for you to not put that pressure on yourself. I would advocate to make decisions based on what's best for you, not what's best for your family. And sometimes I feel like I think I'm a grown woman now, but sometimes I still have to remind myself that, I have to do what's best for me and my family, or me and what I need to do for my life and my career goals. And if you follow that path, and if you are passionate, you're going to have enjoyment out of your life while you are being a role model for others.
Thank you all for that. I'm personally taking this advice to heart as a young Black person pursuing healthcare. And then going off of what you were talking about, Dr. Johnson, I'm going to ask a personal question for all of you for taking on a role in healthcare for yourself specifically and for your career. How do you deal with burnout within healthcare and research in these last couple of years, and self-care tips for someone who is within those roles?
I'll go first. Well, as you know, healthcare providers have been stressed thin. And that goes from whether you're a practitioner, nursing, social workers, it doesn't matter. Everyone's stretched thin, and there's been a lot of burnout nationally. There's a large number of people that have changed professions as a result, because I think our governor is saying we're going to head into an endemic and we're not a pandemic anymore. So basically, he's just saying COVID's here to stay. I was muted. Did you guys? So I have to repeat everything? Okay, good.
We heard you for most of it. It was just a second that you were muted.
Oh, well,
You ended at COVID is here to stay.
Okay, so a lot of people have, professionals actually changed. A lot of practitioners or healthcare professionals have changed careers, because it's here to stay. So basically, you have to look within yourself to see what do you feel that you're getting out of it, and give all you can when you are at work, and then let it go when you walk out the door. Don't take it home with you. And so I looking at the plight of COVID in our inner city areas, I actually volunteered with a group ever since March 2020 that has went out and did testing within the inner city communities, trying to just reduce the occurrence by letting them know that they were positive. And when the vaccinations came around, we did the same thing in the inner city communities. We went out and started administering the shots. And to me, and I do say me, I enjoy that. I enjoy volunteering and giving back. And I can, like, once again, I'm out as a model as a Black healthcare professional, and I'm out in the community delivering a much needed service for free. I do it for no reason other than self-glorification. I love it. I love doing it. I love to see the expression. I love to see the gratitude that they show when they've received the care. And that is like, I get excited about it. I'm trying to get my kids to go with me. But and different things are for different people. But I do highly recommend, though, if you're going to stay in healthcare, do what you can when you're at work, because you can never do it all that needs to be done in whatever amount of time you're scheduled. And then when you go home, you got to do something that's relaxing, something that you can unplug yourself from what you just experienced through your daily work. Family, friends, whatever it takes, a little wine, whatever makes you feel relaxed at home, that's what you need to do. Because then the next morning you start all over, and you need a new mental approach going back into it. So it's important that you do that, whatever that is that allows you to detach, and so that you can start fresh the next day, because this is going to be here for a while.
I'm looking at the question in the chat. I laugh about the self-care tips. To be honest, I don't think that I've mastered the balance that prevents burnout. And sometimes I am personally challenged by that, because I'm very, very passionate about what I do. And that drives me sometimes more than I realize. But what I have been doing is, listening to myself, listening to my body, right? When I am barely staying up, or I find myself depending on caffeine, I'm like, you're tired, right? Or when I start to feel that anxiousness, that nervousness, like I'm losing it, like I'm not doing I think honestly, I had that today where I was telling my daughter, I just feel like I can't get enough done. And luckily, we have these conversations, and I'm glad that, we have the conversations that I didn't have the opportunity to have growing up. It's like, she says, "Mommy, maybe you need to take a break." And I realized, I'm like, you know what? You're right. And so even when listening to ourselves, listening how we feel mentally, physically, that, you may not be able to avoid burnout, but you can avoid working yourself to death by taking those breaks, listening to your body, and oftentimes taking advantages of the breaks that you have. So if you have a spring break, right, don't go making sure, I'm going to catch up on all of this work. Take some time it's okay to take a break. And I'm learning that, you may be learning that, but know that, this is something that we all struggle with. And so if I offer any advice, again, I would ask that you listen to yourself, listen to your body, plan some time off, and not feel guilty for taking time off and relaxing for a change.
Exactly. And I'm going to echo this really quickly because I know we're like 3 minutes over from the questions and answers, but exactly what Rosemary said, like this is a career that requires resiliency, a passion that'll put you farther out with the burnout than other folks who may not be for this career path. And then same thing with Dr. Johnson, you have to listen to yourself, listen to your body. But I wanted to add, listen to folks around you. Sometimes you have friends and family, your kid who tell you, you look tired, you need a break, take a break. As the program director, I've made changes here where you can take a mental health day, you can take a day off. And what I have noticed is that out of my staff who are Black or people of color, they do not take sick time. They do not take that time because it looks bad to them, according to what I hear. It's like, well, I don't want to be the undependable staff person. I don't want to be the one that is always out taking a day off. Meanwhile, my white staff, mental health days, sick days, vacation. I'm the same type. I do not follow my advice. But so advice that I would say, if you have time off, take it. That's what it's there for. You cannot get in trouble for taking a sick day. That's what they're there for. The other part, kind of going over what Rosemary said, wine can be helpful, relaxing for sure. Sometimes the opposite is also good for your mental health. If you had a messed up day and you're stressed the hell out, go someplace, beat something, yell at something, watch a horror movie. Like there's something about the opposite that can also help your mental health, where you just like, you can rise to that level. Because sometimes, yeah, you just go home and you're like upset about something and you can't relax. You can't just take a nap. You're still riled up. So do something that'll just get that heartbeat going, get you going intense, and then you can just naturally wind down. But yeah, do as I say, not as I do, because I do not do any of that stuff.
Yeah, thank you for such an amazing conversation today. We do have a question in the chat. Someone asked, can you provide any final thoughts on your suggestions in building trust within the Black community to move towards lowering healthcare disparities? It's an amazing question.
Well, is that question directed towards healthcare providers or Black, like who is that question directed towards?
It's directed towards whichever profession, any profession within the Black community.
I feel very awkward telling, particularly when we have a healthcare provider on the panel, but if I would suggest, and not you, Rosemary, but to stop disregarding Black folks and listen. I mean, I think that goes a long way. Stop disregarding their pain, stop disregarding what they're saying, stop disregarding their questions, and listen, and stop judging. You know what I mean? I think that will go a long way. You don't have to be a Black provider to provide culturally affirming care. But what you can do is treat people like a person that has needs, and understand that there are cultural differences. But I think at the very crux of it all is to stop disregarding, listen, and be affirming to their needs.
One of the things that I would love to add here is, I'm not sure who's part of the audience listening, but if you're within an organization or a healthcare provider office that you can create change, that's another place that you can start kind of creating this change. For example, in our clinic, we have kind of removed a lot of the anatomical terms for genitals when we're working with transgender folks, where we just call genital testing, genital swabs. And once you get into that comfortable zone with your patient and they prefer to name their anatomy one certain way, you can move with that. But being able to create that change. So same thing when we're talking about Black health equity, being able to change some of the language that we use in medical settings. Like, for example, I brought this up earlier, it's like patient presents with a red rash. Sometimes certain skin tones don't have the same type of physical presentations that can be caught or easily missed by a provider. So I think if you're in a place where you can start changing these things, where maybe it's not the color that you might miss or a different definition of a feeling of a pain, because I think we know that there's certain people that have a higher pain tolerance than others. Being able to kind of change that, where it's not a scale of 1 to 10 and 10 is the worst, maybe a 2 is a worst for a particular situation. So being able to change how we gauge things in the medical field would be a great way to also create that change if possible.
And I want to make a final comment, just paralleling what Dr. Johnson said, and she's absolutely right. The approach to a young Black person, a middle-aged Black person, an elderly Black person is not the same. So you have to be ready and willing to accept that patient as they come to you and their cultural beliefs and what they believe in, what they practice, without judgment. And I know we're out of time, and that's going to be my final comment. Thank you, guys.
Yes, thank you for our awesome panelists for those wonderful answers that I know I will personally take to heart, and I'm sure our audience is also taking them to heart as well. Thank you for our audience for sticking around. We are almost out of time. We do have an evaluation survey that we put in chat and plenty of resources as well. And we want to thank you all for being here. And then Christina, if you have any final comments as well.
Yeah, I just want to say again, this was an amazing, insightful discussion today. I know there are a lot of aspiring healthcare professionals, research professionals as well in the Zoom. So I think this was so informative for me going into this field and for others as well. And I found it very empowering. I found a sense of like spark for passion again for what I do. I know during senior year it can be very hard to find that. So I want to thank you all, the panelists, for being here today and helping bring light to this for these situations. Thank you.
And thank you everyone so much for joining us. Then we will let you go. Thank you so much.